to the bargaining table to reach that fair agreement.
Yeah!
Until then, we're on strike to hold Legacy accountable and make sure our patients and our community can get the health care they need when they need it. As a trauma PA at Legacy for the past 10 years, I've had the privilege and responsibility of taking care of patients on the worst day of their lives, whether it's a devastating car crash, a fall from a roof, or a mountain biking accident. Patients trust me with their lives, and that is the responsibility I take seriously, and so do all of my colleagues. I'm proud to work with my team. The trauma PAs and physicians at Emanuel are among the most skilled, competent, and compassionate providers you will find anywhere. I would trust my life in any of their hands. But it's not enough for patients and providers to trust us. We need Legacy to recognize the importance of our work and treat us with the same professionalism, care, and respect that we give our patients and colleagues. But that won't happen without a fair contract. Over the past decade, we've all watched Legacy let outstanding providers walk away. That leads to longer wait times, damaged patient-provider relationships, which have ultimately harmed our community's healthcare. They've gone to OHSU, Kaiser, and out of state to find places where they are supported and valued, leaving patients with fewer, less experienced providers when they need us the most. That forced exodus of talent falls squarely on the shoulders of Legacy's administration.
Yes, it does.
While we've been fighting to raise standards, Legacy's leadership has said they are comfortable being the 3rd or 4th ranked Portland area hospital in provider compensation and working conditions. Let me be clear about that, what that means. Legacy is comfortable being the worst. I don't want my family or yours taken to the worst hospital on the worst day of their lives. I want them taken to the best. I want them to have passionate, skilled providers who can help them heal and treat them with the respect all human beings deserve. That's what our patient and our communities deserve. We are striking to make Legacy that place again, a place patients can trust. We are striking to keep our exceptional teams intact so we can continue raising standards at Emanuel, Good Sam, all of the other hospital locations at Legacy, and clinics throughout Oregon and Washington. Because we know that without us, our community's healthcare fails. We serve our patients and the public. We will not be silenced or intimidated. And we will not accept the bottom of the barrel because we are better than that and our patients deserve better than that.
Great.
Legacy executives need to return to the table and negotiate a fair contract that retains experienced providers and protects the safety of every patient who comes through the doors. I want to go back to work, but I want to work for an institution I can be proud of, one that values its people and invests in excellent care. That's what we're fighting for. I'm proud to stand here with all of my colleagues and all of you. So what do we want?
Pie.
Who makes the pie at Legacy?
APP.
What do our patients deserve?
The whole damn pie.
Thank you.
Good morning, everyone. My name is Rob Brookshire, and I've spent more than 22 years at Legacy Emanuel Medical Center, the entirety of my career as a physician associate. I echo the thoughts of my co-speakers today, but I also wanted to take a moment and reflect upon the meaning of this morning. 2 years ago, our group organized as 55 inpatient advanced practice providers. This term you know as nurse practitioners, NPAs, or physician associates. In August of this year, we won a judicial ruling and more than doubled our group to nearly 140 APPs, incorporating a diverse group of adult outpatient medical specialty providers. And as we grew stronger, we continued to seek a partnership with Legacy. We earnestly believed we could work together to make Legacy Health stronger. Never in my career would I have imagined standing in such a stark opposition to my employer as I am today in front of you all. But that has become a sobering reality for all of us. The message for legacy executives has been blunt and unambiguous: disregard and disrespect. Legacy leadership has chosen to violate federal law over meaningful communication with our members, refusing to speak to us over these past 10 days, even though we have been available 24 hours a day through the holiday to work toward an acceptable agreement for us and Legacy Health to avoid this very moment this morning. It appears Legacy's legal counsel, the second largest employer-focused law firm in the country, has advised a new strategy to the executive leadership. That advice is essentially the new strategy is essentially to crush the 140 of its own employees, even at the expense of timely patient care and Legacy's own bottom line. Their current strategy invites potential financial hardship upon our members until they are forced back to work to ensure their family's safety and security. We are a relatively small group of advanced practice providers facing off with a handful of executives who wield the financial reins of a multi-billion-dollar healthcare organization. The imbalance is clear. Powerful executives with few consequences for their actions, betting against the people who care for the community when they need us the most. Today highlights a small group of Legacy Health System executives having assessed our daily contribution to the care and safety of our patients to be worth losing. They have decided that refusing to talk about a way forward together and removing our members from their work schedule for the next several weeks is worth the risk to patient safety, a risk they are willing to accept. They have signaled a clear understanding of the very essence of what brings us here today, an inability to value the work and effort to care for patients in all parts of our community, from the surgical services, trauma, cardiothoracic, vascular surgery, the ICU, the ECMO critical care staff, cardiology, inpatient, palliative care, outpatient specialty, medical specialties, including mental health, pulmonary subspecialties, and cancer care specialties. And I'm sure there's others that I'm not including. They are relying on temporary workers unfamiliar with their workflows, charting nursing and therapy teams, surgical environments in the ICU and ECMO teams, raising concerns by many staff members about patient care and safety in these days. No temporary worker will ever match the care we deliver to our patients, nor the contribution of our combined years of experience. One thing we have come to know is our executives will indeed miss every opportunity to do the right thing for its people, despite their lofty mission statement. Their mission now is to crush this group of AVPs. We are small, but we're pretty scrappy, and signal to the various organized groups. These organized groups include physician groups and other APP groups, including the pediatric folks, Go Health for Legacy, a wide array of therapy professionals, and our nursing colleagues, these groups who will follow us. The signal to these groups are, this is how we are going to treat employees who choose collective bargaining. Legacy's executives believe this to be a sound investment in Legacy Health's long-term future. I could not disagree more. As someone who has invested more than 2 decades to Legacy, standing here today, our message to Legacy Health is simple. We are right here where we belong. At Legacy, on strike, advocating for our patients and our colleagues. I'm proud to be here with you this morning. Thank you for being here with me. And if an APP has ever made a difference for you or someone that you love, I hope you support us in the chance to continue making a difference in the future. Thank you.
Good morning. My name is April Collister. I'm a physician associate in cardiothoracic surgery here at Legacy Emanuel and Good Samaritan. While I wish that we were not all standing here in 40-degree weather, away from our patients, our colleagues, and our beloved stale hospital coffee, It is truly an honor to stand alongside you today. As an APP who specializes in cardiac and lung surgery, I can tell you firsthand the heart that we APPs put into our profession. And as APPs, we have a hard time not putting that same amount of dedication into everything we do. I've had the immense privilege of working with a union bargaining team that is composed of a group of the most stubborn, determined, and hard-working people that I know. People who have fought for each and every one of you while maintaining their full-time jobs caring for the people of Oregon. A bargaining team made up of a provider who spends his days putting patients on ECMO, the last lifeline that our modern medical world has to offer, oftentimes getting on a helicopter, never at a convenient time of day, to rescue patients from hospitals that don't have the resources or the expertise that our APPs have. A PA who works right alongside me, removing cancer from lungs, bypassing coronary arteries and replacing heart valves, and spending her nights replacing dissected aortas, stitch by stitch. A nurse practitioner who guides her patients diagnosed with cancer through the heaviest medical journey they may ever make, interpreting every lab, explaining every treatment, mourning each devastating update, and celebrating every win. An NP whose day revolves around the sickest patients in the hospital, those who require a ventilator for every breath, and whose life depends on a line of slowly dripping medications and each of the dozens of clinical decisions that she makes each day. A couple of PAs who make Legacy Emanuel what it is, a level 1 trauma center capable of caring for the sickest and the most vulnerable patients in Oregon and Washington. Patients who are suddenly forced to fight for their life with PAs who are fighting right alongside them. Each and every one of these APPs put their whole heart into these jobs. Our union covers more than just these fields. We represent APPs across 30 different medical specialties. By my estimates, the only organ we don't have an expert in, present and accounted for on this strike line, is the eyeball. So this is my formal invitation to Dr. Glockenflecken to become an honorary member of our union and round out this incredible group of providers. My fellow union members, this Saturday marks 2 years since the start of our union journey. 2 years ago, you trusted us to take a stand, to recognize your worth, your expertise, your clinical skills, and your value. Bring that straight to Legacy and demand better. It has been 2 years since APPs at OHSU, Kaiser, and Legacy said enough is enough. We have done all we can over these past 2 years. Late nights, weekends, 8-hour meetings, spreadsheets, survey data, proposals, renegotiations, phone calls, marches, letters, emails, meetings, town halls, and not to mention enduring utter vitriol from an employer who still cries loudly to anyone who's still listening that they're bargaining in good faith. My fellow providers, we're not passing the torch. We're asking you to carry it with us. We are asking you to take a stand alongside us and hold Legacy accountable. Our patients are trusting you. They're counting on us. They trust us to use every tool, every skill, and every ounce of training we have when we care for them. They trust that the care they receive at Legacy is equal to the care at OHSU, Kaiser, Providence, Adventist, or at any other hospital. And they trust Legacy to give them the resources they need to fulfill those expectations. That trust matters. As providers, as healthcare workers, and as human beings, we have a responsibility to hold our healthcare systems accountable to the promises they make, to put people over profits, and to live up to the mission statements they so proudly display across their walls. Mission statements just like Legacy. Our mission is good health for our people, our patients, our communities, and our world. Above all, we will do the right thing. Legacy APPs, the time is long overdue for Legacy to do the right thing. Now, it is time to take a stand. It is time to demand better, and it is time for us to hold this line. What do we want? Fair contract! When do we want it? Now! Woo!
Thank you all for being here stand here with our colleagues, our friends, our community, and stand up for what we know is right and long overdue and what the Portland community deserves. What do we want? What do we want? Who makes the pie at Legacy?
APPs!
What do we want?
Slice of pie!
What do our patients deserve?
The whole damn pie!
Next, y'all, you're welcome to head back towards the picket line, and then media folks happy to chat with y'all separately.